then it starts to become very apparent what it is you need to communicate. I've been asked to tell you what do doctors need to know from chiropractors, basically. How do you communicate with doctors? Well, first thing you don't do is you don't try to communicate with them after a long day when they've eaten something and they're feeling sleepy. So the first question you really need to ask is, do you need an MD to see your patients? Okay? Because before you have to communicate with an MD, do you need an MD? And I've worked with chiropractors. My original boards were in family practice. I've worked with chiropractors for about 15 years. Doing PI work is actually just a small fraction of what I do. I seem to get referred a lot of patients. Maybe it's because I'm either very good at it or they can't find anyone else. But speaking specifically about working with PI cases, I think, yeah, you probably do if you're a chiropractor. You do need to be able to communicate with MDs because you need an MD involved with your case. It's not because a chiropractor can't do an absolutely fine job of taking care of a PI case. In fact, in the clinics I work with, the chiropractors do probably 95% of the work. Unfortunately, or fortunately, however you choose to look at it in this day and age, when a lawyer takes a PI case, somewhere along the line, he wants an MD to sign the chart. That's just the reality of it. Maybe it's not fair, maybe it's not right, but it is what it is. So you need to be able to have some sort of referral base where you have an MD that you trust, okay, and an MD that you can talk with. The first thing you have to figure out when you're talking to an MD is MDs don't talk chiro. We didn't grow up in the same schools, we didn't learn the same system of medicine. There's this sort of inherent historical animosity between the two professions. And so MDs just don't normally speak what chiros speak. I've worked with chiros for 50. I go to lunch with them, I share the same office space with them, I meet with them every morning and go over the same x-rays. And you guys still say stuff I don't understand all the time. Really, when I first started working with chiros, I had to go, I say, show me your exam, show me what you do, tell me why you do it, tell me what it's called, and what it's telling you. And I had to do that over and over and over again so I could at least have some sort of level playing ground with what you guys know and what you guys do and how you see the world of patients. So you have to teach the MD how to speak your language, and you have to learn kind of how to speak their language. And you have to just simply be aware that you're operating to a certain extent off of a different model. They're different models. One's not better than the other one. They are different. But you also have to remember, and again, I'm talking only about the world of PI, somewhere along the line, the lawyer's going to want someone with the initials MD or DO behind his name to sign off on that. And the more initials after the MD, the better, actually, depending on the case. So, okay. So how do you communicate with an MD beyond that? Well, first place, you need to just simply tell them what it is you need them to do. What it is you don't understand about the patient, or what it is that you do understand the patient, but you have a very specific question about. And the more specific you can be in talking to an MD, the better. And we all kind of learn that. We learn that in our schools. I know I learned it in medical school, and I'm sure you guys learned it in chiro school, where when you're first, when you start out as a medical student, you have to present the case to the resident, and then they have to present it to the attending, and you start out being very nebulous and kind of wandering all over the place, and they kind of whack you and shave you and hone you until hopefully they teach you to get to the point in a very succinct manner, because everyone's kind of in a hurry. So just get to the point. And that's what you need to do, because the doc wants to know, and if he's agreeing to see your patient, if he has a relationship with you, he wants to see that patient. He just wants to know what it is you want, okay? And he wants to do that for a couple of reasons. One, because he wants to look good. He does not want to sign his name. I do not want to sign my name on the bottom line of a history that's primarily based on your care, and then find out in the end that there was some horrible error, okay? So he needs to have confidence in you. And he's in a hurry, just like you're in a hurry. So learn to be succinct. Learn to know what it is you want to know. Sometimes territorial issues come up. If you're a chiropractor, historically, chiropractors are afraid of, I send my patients